So let me first respond to a very basic question that I frequently get, which is what is counseling or what is psychotherapy? I might have a client call who says, I'm interested in counseling, but I'm not really sure what to expect, or someone in my life has recommended that I talk to someone about this issue, but I don't really know if I need to. So let me try to answer that, given the fact that you could write a whole book in response to that question, but I will try to give an answer that is concise yet meaningful. Um, and I'll give a little background. Sometimes you hear the terms therapy, psychotherapy, counseling. Those terms really mean the same thing in most contexts. Sometimes clients have a preference regarding which term they like to use. For example, sometimes psychotherapy sounds a little bit on the clinical side or related to pathology, whereas for some people, counseling sounds a little bit more user-friendly, um, regarding normal people who are seeking help with normal life issues. I use the terms interchangeably. I call myself a therapist or a counselor or a psychotherapist. Um, now, there are some different licensures that all fall under the heading of therapist or psychotherapist. Uh, One could be a licensed clinical social worker like myself, um, a licensed marriage and family therapist, or a licensed professional counselor. Those are all licensures recognized in the state of Texas that fall under the heading of a therapist. Um, there is a little bit of a difference between a psychologist and a therapist. A psychologist has a PhD and generally finishes that in 4 to 6 years of a graduate program. Um, Much of that 4 to 6 years is spent doing research and a dissertation. So psychologists often specialize kind of in that avenue that they did the research in during grad school. So when it comes down to uh, clinical practice or providing counseling, therapists and psychologists really have a similar level of training. Um, as a therapist, I consider myself a generalist. I do not specialize in one particular area. I do counseling for anxiety, for depression, substance abuse, relationship issues, a lot of different areas. I feel like by being a generalist, it actually makes me better at what I do than if I were to specialize, because as a generalist, um, I'm exposed to a lot of different models and tools that can be applied to many of those different life issues. Um, there is sometimes also a little bit of confusion between the terms psychotherapy and psychoanalysis. Psychotherapy just means counseling in all of its forms. Psychoanalysis is a particular school of therapy developed by Sigmund Freud, and that's, when you picture someone laying on a couch and doing free association and talking about the id and the ego and defense mechanisms. That is psychoanalysis, and that's often a process that can take many years or last a lifetime. Um, it's more about exploring the depths of the psyche than it is about solving a specific, discrete life issue that you're going through. And so that's not very common these days. Psychoanalysis is still available. Some therapists provide it, but not very common. A lot of the concepts developed by Sigmund Freud are still used, but psychology and therapy has evolved quite a bit since his time. So now we'll talk a little bit about what actually happens during the counseling process. So I would describe it as having a past, present, and a future component. The past component has to deal with healing from past pain, past emotional pain. The present component has to do with insight and understanding as to current feelings and thoughts and the effect of the past on how we were behaving and operating today. And then the future component has to do with setting goals towards growth and change in whatever area of life you're working on. So it's the counselor's process to guide that and to give feedback along the way, to ask the right questions that are going to promote that thinking, and sometimes involves giving homework exercises, which can be thinking or writing exercises to propel that process. Counseling is not always heavy and serious. It can be at times, but I definitely joke around with my clients quite a bit and use humor in counseling sessions as well. So it's not always heavy. It's not always about tears. Sometimes it's about laughter as well. And we try to keep a balance of that so that you can catch your breath a little bit along the way. One interesting thing to keep in mind if you're interested in counseling is that some therapists or counselors are very partial to their particular school of therapy. You'll hear terms like cognitive behavioral therapy, rational emotive therapy, dialectical behavioral therapy, all of these different schools. And some therapists believe that you must apply a particular school of thought to a particular problem. But the research really shows that which school of thought your therapist uses is not so much important as whether or not they're a good therapist. If they're a good listener, if they're attuned to your individual issues, and if they help you to make a plan and an approach that's specific to what you need. Almost any of these modalities can be very effective if there's a good counselor-client relationship. And the research does show that very clearly that given a life problem, applying counseling to the issue versus no counseling, better outcomes clearly happen with counseling. So there is a little bit of luck in finding a good therapist or a good counselor. Just having a degree and even having many years in practice doesn't necessarily mean that that counselor is good and that they are going to get you where you want to go. You know, we've all heard horror stories about doctors with really bad bedside manner, and sometimes I hear stories from my clients about really bad interactions that they've had with their therapists. So if you have a bad interaction with your therapist, it's best to address that with the therapist to provide an opportunity to maybe fix that if that was a communication misunderstanding, or to have a conversation about whether or not you're going to get what you want from that therapist. If you're really not getting what you need from that therapist, the research also shows that merely switching and trying to work with someone else increases the chance that you will get the positive outcome you're looking for by 50%. So it's worth switching therapists if the current one that you're working with is just not working well. That being said, even a good therapist is going to give you feedback from time to time that may upset you or may not be what you want to hear. And it's often said that if you don't get upset at your therapist ever, then maybe you're not being pushed hard enough. So if you can imagine going to a physical trainer at a gym, you have goals in mind that you want to achieve, and you want to feel the burn sometimes. You want to know that it hurts because you're doing the right work. So not every counseling session is going to feel really good, and you're not going to walk out of the door feeling great each session. But over time, you'll feel better, and sometimes more quickly than you would even think. Research shows that most of the benefit of counseling happens within the first 6 to 10 sessions. In fact, if you don't have any indication of a positive result within the first 6 sessions, it's likely that you're not going to get a positive result with that therapist. So you may need to talk with that therapist or make the decision to try someone different. So if you have any questions, feel free to email me through my website, New Leaf Counseling, and check back as I will be posting videos on other psychology related topics in the near future. Thank you.